collapsible. On this finger, we'll remove the thin parts of the sheath and just leave the thick parts. These act as pulleys for the flexor tendons, as we'll see. At each joint, the sheath is attached to the edge of the palmar plate. Between the joints, the sheath is attached along each phalanx. The floor of the tunnel for the flexor tendons is formed by the palmar plates and by the smooth, flattened surfaces of the phalanges. The thumb has a similar flexor tendon sheath, for it's one long flexor tendon. The arrangement for the extensor tendon is entirely different and quite complex. On each finger, the extensor tendon and the tendons of 3 intrinsic muscles come together to form a structure called the extensor mechanism. Let's take a look at it. We'll look at the muscles themselves a little later. So that we can see the extensor mechanism from all sides, we'll look at one finger in isolation. Here's the extensor tendon approaching the back of the MP joint. Here, both on the radial side and on the ulnar side, is the tendon of one of the interosseous muscles. In addition, here, on the radial side only, is the tendon of a lumbrical muscle. On each side, a triangular sheet of tendinous tissue fans out and connects the extensor tendon to the interosseous tendon. This triangular sheet is called the extensor hood. The big extensor tendon divides into 3 slips over the proximal phalanx. The central slip crosses the proximal IP joint and inserts here, on the base of the middle phalanx. The slips on each side fuse with the interosseous tendon to form the 2 lateral bands. The lateral bands join together over the middle phalanx and insert here, on the base of the distal phalanx. The thumb doesn't have such a complex extensor mechanism. The insertion of its 2 extensor tendons is relatively simple, as we'll see. One last structure to look at before we move on to muscles is the palmar fascia, or palmar aponeurosis. It's a dense triangular sheet of fibrous tissue which covers the middle part of the palm of the hand. Proximally, it's continuous with the flexor retinaculum and with the tendon of palmaris longus. Distally, it separates into slips, which insert into the edges of the palmar plates of the MP joints. The palmar fascia protects the underlying nerves, tendons, and vessels from harm. The skin of the palm of the hand is firmly attached to it. Now that we've looked at the bones, joints, and pulleys of the hand, we're almost ready to see the muscles. Before we do that, let's review what we've seen so far. Here are the carpal bones, the metacarpals, the proximal phalanges, middle phalanges, and distal phalanges. The carpometacarpal joints, the MP joints of the fingers, the proximal IP joints, the distal IP joints. On the thumb, the MP joint and the IP joint. Here's the flexor retinaculum and the side tunnel for the ulnar nerve. The extensor retinaculum, the flexor tendon sheath, the palmar plate, the collateral ligaments of the MP joint, the extensor mechanism, and the palmar aponeurosis. Now we'll move on to look at the muscles of the hand. We'll begin by looking at the extrinsic muscles, the long muscles of the hand which lie in the forearm. Then we'll move on to look at the intrinsic muscles, the short muscles that lie in the hand. Starting with the extrinsic muscles then, we'll look first at the flexors of the fingers, then at the extensors of the fingers, and lastly we'll look at the 4 long muscles of the thumb. Flexion of the fingers is produced by 2 long muscles, flexor digitorum profundus and flexor digitorum superficialis. Here's the deep finger flexor, flexor digitorum profundus. It arises from the anterior and medial surface of the ulna and from the interosseous membrane. Here are its 4 tendons, entering the carpal tunnel. We'll follow them in a minute. This adjoining muscle we'll see later on. It's flexor pollicis longus, the long thumb flexor. Now let's add the superficial finger flexor, flexor digitorum superficialis, to the picture. Here it is. It lies right on top of the profundus. It has 2 heads of origin, a radial head and a humero-ulnar head. The humero-ulnar head arises as part of the common flexor tendon from the medial epicondyle of the humerus and also from the adjoining ulna. Its radial head arises from this long oblique line on the radius. Between the 2 heads, there's a gap which the median nerve and the ulnar artery both pass through. The 4 separate tendons of flexor digitorum superficialis are bundled together as they enter the carpal tunnel. Before we follow the superficialis and profundus tendons into the hand, we'll bring the forearm to the upright position. As the flexor tendons pass through the carpal tunnel, they're all enfolded within this common synovial sheath, which extends into the palm of the hand. Just as the flexor tendons emerge from the carpal tunnel, the 4 profundus tendons give rise to these 4 intrinsic muscles, the lumbricals. We'll be looking at these later. For now, we'll remove them to simplify the picture. Just before reaching the MP joint, the superficialis and profundus tendons of each finger enter the flexor tendon sheath together. To follow them, we'll remove the sheath. Over the proximal phalanx, the superficialis tendon splits into 2 halves, which pass around the profundus tendon. We'll remove the profundus tendon for a moment. The 2 halves of the superficialis tendon reunite, and as they do so, they insert here, on the middle phalanx. The profundus tendon, here it is back in place,